around the state of Florida.
Let's move on to health care. You mentioned that you support Medicare for all. A study earlier this summer from George Mason University estimates that Medicare for all, that plan, would cost the government $33 trillion with a T dollars over the next decade, which obviously would be a significant tax increase. Florida has a reputation, as you know, for being a tax-averse state. Are you ready to tell the people of Florida that they need to pay a lot more in taxes to fund your health care plan?
Well, let me first say there was also a report, Dana, that showed that should we move to cover more people through a Medicare for all system, we could actually save the system trillions over an extended period of time.
You could, but in the short term, in order to do
that,
you need to raise taxes. Fair?
So what I would say is, first of all, and I want to be clear about this, the state of Florida could not take this road by itself. We would need to do it as part of a federation of other states coming together. Think of Florida, New York, California,
but
and
sir,
a few of the other larger states.
in order to do that, taxes would have to be raised. Is that fair? Do you agree with that?
I don't buy that. So let me just say, for instance,
how do you do that? How do you find that kind of money for the government without raising taxes?
So first, I'd say, one, Florida could not do it by itself. But secondly, we have the opportunity to expand Medicaid for over 700,000 of the most medically needy people here in the state of Florida. My governor and legislature refused to do that. Do you know it costs us about $6 billion in money that should have come from the federal government to the state of Florida that we never received? And so I'm simply saying, and I want to be clear, Dana, this is very personal to me. I remember growing up as a kid having to wait for the mobile dental clinic to come through the neighborhood in order to have my teeth cleaned.
Yeah, I know.
The
I know
biggest
you have
concern
experiences,
for people,
and you're coming from a real place, a personal place, in supporting this. But as a government official, you have to make it work, and you have to make the numbers work. And so I still don't understand how you would do it without raising taxes.
So the first step we would take is expand Medicaid and pull down about $6 billion a year from the federal government. That's important. Secondly, as governor of the state of Florida, I would work to bring a number of the largest states into a conversation how it is together we might be able to negotiate prices and access to health care to cover more people and ensure that even those of us who are insured, who are right now paying premium increases year over year over year, all because Ron DeSantis and Donald Trump have worked overtime to make access to health care less affordable.
Will you say that you will not support raising taxes to make your health care plan work?
I will absolutely not raise taxes on everyday working Floridians to give access to additional people.
What about wealthier people?
So what I said, and I ran on this, by the way, is that we will increase taxes for corporations in our state who right now, just so you're aware, only 3% of companies in the state of Florida pay the corporate tax rate, 3%. And that 3% under the Donald Trump tax scam got a windfall of $6.3 billion overnight due to the tax reform that took place in Washington, D.C. We're not asking for all of it. We simply said we believe that we ought to bring $1 billion of that money back into the state's government because being a cheap date state has not worked for the state of Florida.
One more.
And unfortunately, we've got to do that if we're